At Kina Mutual Group, we believe that a brighter financial future should be accessible to everyone. That's really important. Kina Mutual Group and its foundation has a long-standing history of investing in the community where we have a footprint. Every year, we're averaging at least 9,000, 10,000 volunteer hours that are reported and recorded. But each one of those community members always says to me, with the employees, with the leadership at Kina Mutual Group, you all authentically show up. The fact that you do support your employees, that shows that you are invested in the community. There is something so special about doing something as a collective whole where you have these shared experiences. It is worth it. Not was, it is worth it.
For her dreams policy from American Family Insurance. Insure carefully. Dream fearlessly.
Hi, I'm Kim Sponham, CEO and President of Summit Credit Union. We are so excited to sponsor another Madison 365 Women's Leadership Summit. Women's financial health is especially important to us at Summit Credit Union, and we've focused on it for more than a decade. Women are twice as likely as men to associate negative emotions with their finances, and it's no mystery why. Women still earn less than men for a variety of reasons. Women have less saved for retirement, and they're almost half as likely to invest in the stock market when compared to their male counterparts. But we're also seeing positive signs. There are more female entrepreneurs than ever before, and we know from experience that women with higher levels of financial literacy tend to save more, spend more wisely, and invest more than their peers. I encourage you to use this conference as an opportunity to improve your own financial literacy and find inspiration in the incredible women joining us today. Thank you for letting us be a part of your journey.
Hello, and welcome to day 4 of the second annual Women's Leadership Summit. And thank you especially to our sponsors. Have you been watching this week? I know I have. And one underlying theme that sticks out with me is that women are now present in more spaces than ever before. It's imperative that our impact in these spaces is respected and celebrated, and not just tolerated. Today, we'll be discussing crisis in care, a burden women primarily have to shoulder. In some communities, there is scarcity in childcare, and in others, we are witnessing childcare deserts. My name is Yvette Craig, and I have the privilege of serving as your moderator. Welcome, one and all. We are excited to bring this panel of experts to you to discuss this urgent issue. So without further ado, let's meet our panelists. Please take a moment to introduce yourselves to our listeners and viewers. Let's start with Miss Annie.
Hi, my name is Annie Weatherby Flowers, and I am Community Engagement Coordinator for the Madison Public Library as assistant. I'm also founder and chair of Coogee Chocolate and Madison Center for Self-Determination, which brings to you the Juneteenth Day celebration every year. So that's just simply who I am.
Well, thank you, Miss Annie. And for those who are listening, Miss Annie is one of those that you just can't sit still. So she's on the move, but she is taking time to help us with this discussion today. Mai, would you like to go next?
Hi, afternoon, everyone. Nyajong. My name is Mai Lo Lee, and the pronouns I use are she, her, and hers. And I'm coming from the Northeast Wisconsin region. My 9 to 5 title is that I serve as director for the Multi-Ethnic Student Affairs Office at the University of Wisconsin, Green Bay, in Green Bay, Wisconsin. Thank you so much for the invite.
Thank you so much. How about you, Jenny?
Hi, good afternoon, everybody. My name is Jenny Van Sickle. I am Tlingit Athabaskan Chikakwan Kiksadi Gajahin. I'm born and raised in Alaska, but I am up here in Superior, Wisconsin, and I am also the Madison 365's inaugural Woman of Excellence, and I'm the current president of the City Council up here.
Fantastic. And Fabiola, which is such a beautiful name. I apologize for messing it up a little bit there.
No, not at all. Good afternoon, buenas tardes a todos los que están escuchando. My name is Fabiola Hamdan. I use the pronouns she, hers, ella, and I am the Immigration Affairs Supervisor with the County Department of Human Services. I immigrated to this country about 37 years ago from La Paz, Bolivia. Very happy to be in this great panel. Thank you. Gracias.
Thank you all. And before we jump in, let me briefly share some statistics. Families are navigating professional and personal responsibilities in this COVID-19 era. The findings are clear. We are facing an unprecedented crisis of care. The pandemic has exacerbated structural inequalities that force too many to choose between their jobs, their own health, and the health of their loved ones. And it's the low-income earning families of color and women who have disproportionately borne the brunt of the crisis. The average cost of childcare for an infant in Wisconsin is $12,567, according to the study of Economic Policy Institute. This makes infant care in Wisconsin 48.3% more expensive than the average in-state tuition for a 4-year public college. According to the Wisconsin Department of Children and Families, the number of family providers across the state have dropped from 2,644 to $1,995 between 2015 and 2021. Can you please mute your phone? Thank you, ma'am. Family providers on average have about 5 children to care for. They spend nearly 60 hours a week providing this child care, and they earn on average a net income of $1,790 a month, which equates to a mere $7.46 an hour, pennies above the state's minimum wage of $7.25. So I'm sure it's not surprising that we are seeing numbers of family care providers abandoning this field. This forces many families to make difficult decisions. So ladies, let's talk about this. How has this crisis impacted your own families and the families you support in the community? Fabi, would you like to start?
Great. Well, I don't know where to start really. You know, I myself as a mom and having 2 kids and having gone through that stage of my life where it was really hard to choose. You know, I'm a professional. I want to continue with my career, but at the same time, I wanted to have a quality childcare provider for my children. It was really hard, and locally they are grown now. But I did work as a community social worker for 18 years, and I have seen many suffering, right, in the families that cannot afford quality childcare. And I think everybody is going to, at one point or another, even if you have 2 household incomes, it's expensive. We're talking about quality childcare. You can find childcare, and many of the families that I work with will find, childcare providers or the neighbor or la tia, the uncle or the aunt or whomever to watch the kids. But then, that's where we have all, and maybe we're going to talk about this later on. But I think I just wanted to start us thinking about how hard it is for families that cannot afford this quality childcare. And then we can continue later on. I think we have more questions there.
Jenny, would you like to answer that for us as well?
Yeah. Where do we start, right?
Yes.
Where? This really came into my world. Number one, I only pick small fights. So this really came into my world. My babies are also grown. And I think something that really started to get under my skin is in traditional systems, right? We look at business owners and entrepreneurs with a lot of fandom when they're men. But if women are watching kids out of their homes or in facilities, elected officials become much more indifferent and much more stingy with their grants and their support, right? Their incentives. And I got into this because our local housing authority in Superior went to bat with a little home provider that lived in my district. And we had 11 families on the chopping block because of their decisions. And I said, absolutely not on my watch, we're going to war.
You are fierce, and we appreciate that. So we're going to delve into that a little more. Mai, would you like to address this as well? How has this crisis impacted your own family or families that you know in your community?
Yeah. I think for me, I have to be really honest that I identify as a dual income household, and me and my partner, we struggled, and then also being dual language and having agency and voice to speak with my Hmong community who was in need. I think that was very difficult because I wasn't able to provide answers. So people who were, kind of reflect, Ma, you are the educated English speaking, you should know where the resources and the answers are. I mean, it was very difficult to say, I myself am struggling, and I think, like Jenny said, it is not bananas on me that childcare is a predominantly female-owned business that also hires predominantly female staff, that also serves predominantly female mothers, and so there is this trickle line of this infrastructure that's there, and yet those who are supposed to aid and assist is not helping that infrastructure. What my Hmong community has done and we've seen is because we're a collective community, we're able to call on families to assist, but not knowing how long this pandemic or this crisis was going to be. Aunties and grandmas are not supposed to be there for 2 years. They're supposed to be there when you don't have enough sick days, when it's a temporary, but for that long, and then throwing the component of virtual learning. I mean, grandmas and aunties are not set up to be able to log in with your child, set up, make sure that their educational is, so there's this component, where my 9-year-old, where it was like, we have to be side by side with her to make sure that her education is that she's engaged and and there's no technology woes. But there was an intergenerational disconnect, even though, we had older people watching kids, they couldn't engage on the educational aspect of learning within this crisis. So that's what I can reflect on within my community and with what was going on within Northeast Wisconsin.
I know a lot of people can relate to that. Miss Annie,
Yes.
Are you a foster mom, Miss Annie?
I am again, but temporarily, but I have been one. So I can go back to being a teen mom and the need for childcare. But back when I was a teen mom, we had our parents and we had lots more women who were still in the home. So my mother, my grandmother, my older sister. But as a foster parent for years, and now as a person who works with families and communities, we look at childcare. We don't never apply the equity lens to childcare. So I think that whenever a corporation or a company really said that they are about equity, then they should have childcare subsidies. So they should have on-site childcare. Like I know John Deere was doing that at one point, but the lack of childcare, particularly for people who are second shift or nurses who work weekends, because most childcare places are open only from 9 to 5, a traditional work period, and that leaves people who need second shift, third shift daycare in the pickle. So I think in terms of how we look at stuff from an equitable lens, if we really start doing that with communities that are impacted, with working mothers, working families, but particularly if you look at the dynamics of low-income folks who are having it the hardest, I think COVID really shined a light on all of the inequities that are connected with poverty, or people who work under or at poverty line. It showed you the lack of daycare, the inability, like for your mother to really be computer literate. Maybe she could keep the kids, but she couldn't make sure they maintain our schools, their level of schooling. And so I think in terms of how we look at roads and infrastructures, we should look at childcare, because it's just as necessary for families. And now that we have same-sex marriages, we have two fathers who now have to enter into that place of finding childcare, finding that role. So maybe in terms of looking at white male privilege, maybe now if we collectively start addressing it, we can actually have it kind of like, on how now we have incentives for exercise and health related kinds of things. I think childcare should be ranked higher than that, but it should be looked at in the same light. So that's my thoughts around childcare.
We could really drop the mic with just from that first question. I think you ladies have given some very insightful comments, but let's move on to the next question. How do you create a system of quality care that pays workers with competitive wages and keep prices affordable for all families? Mai, would you like to start?
Yeah, I just don't think healthcare is seen as a crisis. And so until it becomes seen as universal and affecting everyone, I think that's one of the first things. And coming from my education lens, I think about all the push and incentive that, public education has put into STEM. We were behind on STEM. So now we're going to promote this and put infrastructure and so we really need to look at childcare as that. And I don't want to say subsidized, because I think oftentimes when it's subsidized, that may even equate to lower quality. But I think realizing that this is a high quality product that all families need, and that it needs to be on, is it a equitable sliding scale? Is it, how do we incentivize business owners to sustain it? Because Yvette, like you said, we might be able to incentivize and do it, but if there's no more business owners, there's still, that need will still be there, but there's going to be individuals who are not meeting that need. And now this is where we're going to be, we're going to, in a sense, have money in the desert, but with no shops. It just doesn't make sense, and so I think we really need to attack, like what Annie said, is everyone is using roads, everyone is using that map infrastructure, so we, I think as a state and as a country, really need to look at it as like a national crisis.
Jenny, I saw you nodding your head. You want to talk about this a little bit more?
Yeah, I, like many of us, operate just on rage alone. So I was going through some records and I saw these, bonuses that different executives were giving themselves in our community. And so when we got our ARPA money, I proposed setting aside $200,000 of it for existing providers, right? We have to make sure that we're expanding our opportunities for childcare, but how do we support existing providers first? So we built a graduated grant system that incentivized providers that were already jumping through all those hoops with Wisconsin work, or the different programs from the state, and we built in bonuses for employees to not only recruit but retain them at their current jobs with substantial education and technology supports. Because there's something really, really endearing when we see men struggling with childcare. Like when they're on the Zooms and the baby runs through the back, it's so cute. But women are not allowed to show those different sides. We're not allowed to cross the boundaries of professionalism, and with our kids and families, we have to keep it very separate. So I just want to call out that standard, that it's adorable when men bring kids to work. We don't have that same privilege.
Fabiola?
I really like what you are saying, Jenny. So I want to go back a little bit and maybe share with you an example. As back when I was a community social worker, we had the Latino community was growing here in Madison-Dane County, and obviously a lot of needs were growing. So we had, I vividly remind this, and this was public information. So we had this young Latina mom that was called to work to a hotel, and she didn't have a childcare. So she ended up taking 3-year-old with her to work, and supervisors allowed that to happen. And as she was trying to work, a little kid went into the swimming pool and died, drowned himself. So it was like this tragic, thing that happened, and that immediately we had to start doing something about this, meetings, and call our elected officials to say, okay, do we need to have this tragedy happen for you to really provide some services to these families? So we work with the local agency, forces, and in trying to really do family childcare. These family childcare providers. We had many stay-home moms, and start doing some classes so they can acquire the certification to do home childcare. And so it was, a panic moment. Everybody was, and then the momentum just died. And since then, I think, some other agencies have tried to do that, but you're right, it's just like, something tragic like this needs to happen for us to act. It shouldn't be like that. Right now that I work with our immigrant community, we have so many people, refugees, asylees living here, and we have, not most, without generalizing, a lot of the women are, stay-home moms. Why can we provide some sort of education, some sort of assistance where they can, do childcare from their homes, from their apartments? It works. It did work at that time, and really, I think it is. Really sad that what I experienced, and from there, being in the Department of Human Services, a lot of the stuff that we saw with sexual abuse, negligence, everything had to do because of the quality childcare was not there, and families with multiple kids, the oldest kids watching for the little ones. Annie said, I had families that worked third shift. They had to leave their kids alone. How about if a fire or something would have happened that night when mom was at work? Kids were sleeping. So there's multiple examples like this, and it really gets me angry to see, how our government, spends so much money in defense and a lot of other things that I don't want to mention here publicly, and not really, invest and the most important thing that we have, our kids.
And panelists, I just want you to know if you need to jump in at any time, please feel free to do so. I know I didn't reach out to Annie on this question, but Mai, I think you had a follow-up you wanted to expand on.
Yeah, that I did. I was just gonna say, and I know we're looking at it at, at kind of like a bird's eye view, but I also think this is an opportunity to demand more from our businesses. Childcare is part of the, workforce cycle. So for them to say that they want, people, working, childcare is an aspect and an issue on this, and they need to not only demand more from, where, the cities that they are making, or that they're settling in and making their business in. But I mean, this is a community-based initiative where businesses need to ask what the cities are doing to ensure that employees are sustaining a high-quality childcare. They need to look at their benefits package to say, do we need to incentivize better? I mean, so this childcare isn't just like a household. I mean, this is really the economics of what's going on.
Absolutely, absolutely. And Miss Annie, I didn't know if you want to expound on that or if you'd like to talk, more specifics about what our leaders in our communities can do, whether it's locally, statewide, or nationally. What can we do to address this?
I think in terms of how we've pushed equity and diversity over the years, we have not necessarily pushed equal benefits for women or for parents. So we have parental leave with FMLA, but I think that process stopped short of what it needed to do, because if we look at the long term about employment and about folks being able to grow and with retention, a lot of women leave, a lot of people leave work because of childcare issues. A lot of people have work-related performance issues because of sick children. And so I think in terms of if we really would push that across the political and across the economic spectrum as to childcare as a necessity, just like I mentioned earlier, in terms of infrastructure, because you can't get to work without roads, planes, and trains and high-speed rail, however you want to frame it. But somehow we see childcare as a woman's role and as a woman's responsibility. And if you choose to have kids, so then you have to suck it up and bear it. But I think that is the wrong way to look at it. I think education and early education is what actually helps our children succeed later in life. But a family-oriented work environment also helps with retention. It helps with profits, because you don't lose because you've got people missing. And so I just think we should think about it differently. And that's like when I talk about an equitable lens, because we look at equity in terms of your memberships, your race, your color, but also your status as a parent or as a caregiver, because they also think about grandmothers who are caregivers as well.
That's a very good point. Anyone else want to discuss what do you think our leaders in our community should be doing locally, nationally, or statewide? Jenny, did you want to say something?
Yeah, I think we really have to push our elected officials. Sometimes you have elected officials that lean on indifference, or that's not really our role. We pick up the garbage when we fill the potholes, right, on our best days. But it is also their job to care about our babies and babies that aren't theirs. And when I really started working on this, I had a local male-dominated ship factory building organization approach me, and it's like they were asking me for tampons, right? So it's like, hey, we have a childcare crisis. And I don't think this has ever been their problem before, right? So I was thrilled because I knew once they came to the table, this was going to be taken seriously. Because here is a Carhartt's wearing saying like, hey, we have a childcare problem, city. And, I started writing this grant to the state, the Dream Up grant, and I put them at the top of my task team because this is serious. And I reached out to people that are no fans of mine, right? The business association folks, the small business folks, and they got right on board because they see this is 100% a workforce issue and that women are leaving the workforce at 5 times the rate of men. This was absolutely serious, and they got right on board.
Very good point. Very good point. Fabiola, what can we do to get our leaders to pay attention to this? What are some of your suggestions?
Along to the lines, Jenny, I think, and again, we really don't have to wait for tragedies to happen, so for our leaders to react. And also upon us as community members, it takes a lot of us to really advocate for this, quality childcare. But we don't, right? Because we, what are our priorities or the work, and we're busy and all of that. I think, it almost seems to me like we need to do a huge campaign, especially when elections come, and say, okay, where are you? We're having those very soon. And the first question will be, what are your priorities? So what is your plan about what, this gap that exists, for those that could afford childcare and the other ones that are the majority, in my opinion, that cannot really afford childcare. So we need to do, and that's why I was saying, Madison 365. Thank you for bringing up this type of topics, because we need to talk about it. And I know many people that are looking, maybe watching this. We need to advocate, and this has to be a priority. And yes, maybe many of us, our kids are already, grown and don't need childcare, but we still need to advocate because, for the well-being of our community. We didn't even talk about, paid maternity leave, all of that. I mean, those things really need to have we need to have the ears of our leaders to listen to us, and testimonies and things like that. And I guess advocacy, and then especially using election times, I think we need to go and ask these direct questions about what it is that, especially right now when we are seeing all this injustice is happening with women, right? Why, when I started, when I said, why as a woman do I have to choose, okay, that my career, or do I stay home? I want to stay home, I want my kids to have quality childcare, but I'm gonna wait for my professional life to, as a woman, I wanted to succeed. I wanted to do that. And many of us, we put that behind, right? Because our priorities are our children. And that doesn't really happen. I have a great husband and all of that. Don't take me wrong, but it really, it comes to the women. Our job to do this childcare, to do all of the multi tasks things that we do as women.
Step in and just keep things going. Miss Annie, I see you'd want to add something.
Yes, I do. So right now we got all of the rope. On it, and the boiler just okay. All right. Can you hear me now?
Yes. Can you start?
Okay. Okay. So right now, all eyes and all conversations about Roe versus Wade, and that's women's right to choose. But right now is a crucial time to really start to pair. Some women have abortions because they just can't afford it. They don't have any childcare. There's a lot of things that go along with that. So maybe in terms of having us build coalitions around all of the things that come into play when women think about family planning. Childcare is one of those. And so how do we lobby now for better childcare provisions for working women or childbearing age women too, to kind of piggyback on an issue that's really at the forefront. Sometimes we take everything individual. You never look at the collectiveness where everything's interconnected. So we talk about intersectionality in the diversity world, but the childcare and sometimes people's ability to afford another child is all connected. And so how do we make that a full-blown topic where we have this issue as well associated with that? And so I think in terms of really looking at having lobbyists, because we have lobbyists for everything. That's why corporations, they pay lobbyists to push and to meet and to really push their agenda forward. How do we do that from a community-based and from a community-based coalition or co-production with businesses who are experiencing those kinds of retention issues, attendance issues, and productivity issues?
Yvette, if I can bring my personal background, so I come from a farming background, and I think one of the things, I think we talked about like getting our elected officials aware of this issue, and I think they're aware of this issue. I'm demanding for them to do something about this issue, and for me, when you look at other countries and what they're doing, they are subsidizing childcare, and from my farming background, I have seen the benefits of farmers getting subsidized, and farmers only wake about 1% of our US population. So they're a dying occupation that our federal government subsidize, to help to make sure that they still stay in business, that they don't have bankruptcy, that they're encouraged to sustain their occupation. This is a very easy, application to another career into childcare. But when you look at what other countries are doing right, who have high quality in the childcare, their government is invested in providing some type of aspect of a subsidized daycare directly to the business owners. That then has a ripple effect of the parents doing it, and then has a ripple effect of the workforce on, and so I think for me, I'm just thinking like, what is applicable? What can I ask for? And as my parents were farmers and they benefited from subsidies that helped them when it was poor years, when it was years. But I think that's a solution that not only do I want my elected officials to know about this, because I know that they know, I want them to do something about this.
Being the moderator today is hard because if I weren't and I was listening at home, I would be shouting, amen, say that, and all of that. So you guys are, I'm really enjoying this. So thank you for that. And it really isn't a laughing matter. This is a very crucial topic. We do have a question that one of our listeners or viewers, excuse me, I keep talking like I'm on the radio, but one of our viewers has asked, and I'm going to read it now, child care programs need to have access to health care and retirement benefits, which is not often available. Can we develop a benefits pool that child care programs and providers can access? Would anyone like to?
I'll go. I went to Dubai for my birthday. And in Dubai, they don't tax their people. They have universal health care, dental, vision. They have a wonderful school system. And the way they approach COVID in terms of as a system-wide kind of initiative with almost 100% compliance by their community, its citizens. And so when we look at this in terms of individual wealth, see, that's the foundation of the Constitution. It was designed for white landowners or white rich men, and we have built on that foundation for centuries. And so in order to be different, we have to do different. We say politicians should do this, but we don't have elected officials who look at the best interests of their communities or their constituents anymore. They look at the best interests of those who can get them reelected. And so in terms of childcare, we talk about subsidies, but why isn't it just is? in terms of, because it's a necessity across the board. It impacts all folks. But people who have the hardest time is people who have the least amount of money or the least amount of political power. Women for years couldn't vote. Low-income people tend to not vote as like they should. So how do we, in terms of community folks, really look at following the money, following the resources, and having some folks that we get paid to actually lobby and be there all the time to ensure that we have the same kinds of advantage as Facebook and as the automobile markets. But how do we make corporations be accountable to the communities and to the taxpayers who subsidize them for billions of dollars when childcare would be less than that than what we give to corporations right now or to defense. So what's more important? And that's what we have to figure out as a community. Because we can throw and say my elected official, but some of those change every 4 years. But if you're getting Senate and the lobbyists in your ear and in your pocket, who are you going to go with, and what issues are you going to push? And I think we need to be more strategic as childcare, just like we do with civil rights, just like we do with police brutality. The people who are most impacted by those things are the people with the least amount of resources. So how do we get allies with larger corporations like my sister just said, the larger corporation that came to her and things started to change because it was all about the money and the big businesses. So we have to figure out how to partner not only with our community, but also with the businesses who benefit from people having retention and attendance, great attendance. So it's all of us. It's not just how do we as community organizations or community leaders, it's all of us need to challenge and say we need childcare. And that's like we need healthcare.
Yes, ma'am. Yes, ma'am. I love the fact that you say to be different, we have to do different. But I think we need to emphasize, we have an election year, right? Everyone needs to not only register to vote, but to get out and actually vote and make sure your neighbors get there and whoever else that needs to go as well. One of the things that I hear a lot of is people say, well, you're the ones out there having the kids, we shouldn't have to be responsible for your kids. You're the ones that had them. But can you all help explain the impact of the lack of quality of care for families and in neighborhoods and communities? Let me say that again. So what impact on the lack of quality care for families, what does that have on neighborhoods and communities?
Well, I want to start by saying also, in top of what we just heard from Annie, is that we are not thinking well about the future of the children, right? Our children. If you have your children not in a quality childcare where the child is exposed to, counting numbers and colors, and by the time they reach kindergarten, they are getting ready, right? So it's like a stepping stone. Now we have kids, especially in our communities that are impoverished. We have children that grandma is watching. The children or the aunt or this childcare places that are not really some of them I went and visit. They're doing what they can with whatever they have, but it's not providing that type of enrichment to our children. So that's the other thing that we need to also talk about, because this is the disadvantage of children that once they are starting school, the gap is growing and growing, and sometimes we don't connect that, right? So for the people that say, oh, why do I have to pay for childcare, I don't have kids, or whatever the reason is, we have to say that I think the future, are our children. We always say that, if they don't succeed in schools, if they, drop out from schools. I mean, I'm just kind of throwing out this, our community is not going to be, I don't want to say safe, but it's not going to be a great community to be, we're just going to be in a disadvantage. So it's not those people with kids and us, here, or those people that, cannot afford the childcare, quality childcare. It's the community. And sometimes we don't, we have to make people understand that everything goes together. And everything engages. I mean, I love the city. I love, I consider myself Madisonian. I need to do something every day to better up my community because I love here. I wanted to live here, and I cannot just pick and choose whatever I want for my, for me that can work.
Yeah, but for me, I think about like the overall societal message that my children who look like me or identify as BIPOC do not deserve quality care. I mean, so I think for me, I look at it from that societal lens of like children who look like us are not deserving of a high quality childcare system. And I think that's something that everybody needs to look at and really examine on that equity lens on who we're saying deserves a high quality childcare system and who isn't getting it and why not. I love that there is childcare relief money right now, but knowing that it's only a short-term solution and knowing that they think it's going to go away. Like, oh, well, this is just a temporary problem. And it's not. I think we've all highlighted that this COVID pandemic has just put a brighter light on this. Childcare and childcare access has always been an issue. It's just that this pandemic has really put a highlight on it. And now maybe more visibility because it's affecting everyone. It's always been affecting our vulnerable populations, but now it's affecting everyone.
I'm sorry, Jenny.
Oh, yeah. I mean, this is totally solvable. That's what's, I think, sometimes totally like infuriating. Is this a unique problem in the United States? Just like saying, how do we get benefits to every employee? It's solvable. It's always, I always think about, people that are willing to pay for prisons, but not education. Or how my family was criticized because like we all live together, aunties, uncles, cousins, sisters, we all live together because that was a lot of built-in childcare too, and how we were, ridiculed as like freaks, but as a millennial, I have a lot of friends that are criticized for not having kids, right? We've like canceled the family or something. So like we get it on both sides. We're having too many kids and we're not having enough kids. And, as far as voting, like, yeah, we do have to vote in the spring. We have to vote in the spring. And, there are so many times that my local work could have been interrupted or stopped altogether by the administration. But, school boards, city councils, they can do more. They can. Don't let them tell you it's not their job. It is.
Did we freeze? We're having some technical issues, but I believe Jenny is back.
I'm sorry. Am I okay?
Yes, you are. Maybe it was my internet connection. I'm not sure.
Did we hear the tangent or?
No, Jenny, I was just going to say it was not a tangent. We did hear you. And Yvette, I think it was on your end that froze because you froze on my screen. Oh. But it was just for a little bit.
Right, even that self-deprecating language, right?
Did you just sign on?
Well, I think with all things, until we come together, you know, um, and really collectively start talking about the inequities that impact families, but most of all that impact women in poor communities. We're not necessarily thinking about that. We have billions of dollars that goes into defense because that is America, red, white, and blue. We are the greatest nation in terms of military strength, but we're not the greatest nation in terms of people strength because we're not all people here are getting access to the same level of quality care, quality education, quality of life, and to reach their full potential. So everyone is not being able to get the life, the pursuit of the life, the happiness, and the life. Y'all know what I'm talking about, and the pursuit of happiness. And childcare is fundamental for that. Fundamental for that.
All right. Let's get to another question. I can't believe the time has just flown by. We have less than 10 minutes already, ladies. But I'd like for each of you, I think it was Mai that touched on this briefly, but child care relief money will continue through 2024, but it's only short term. This is what you discussed. When thinking long term, what are important factors political leaders should address? And I know we've talked about this a little bit more, but let's expound on this a little bit when it comes to the relief form. Bobby, would you like to take this?
Sure. Yeah, just what May said about it's a short term. So I think what we need to do is learn what happened with this, with this relief money, what lessons or how did it help or work or did not work. But as you said, it's just short term and then it's like gone again. And I think it maybe, before it comes to the ending part, mobilize and to keep going on more. But I think, I'm not very familiar how this the relief money worked, but the people that were administrating that, hopefully, maybe, get the feedback exactly about how did it work, did it not work, did it help, or who did it help, and we need to look closely to that, because this is kind of this pilot, a lot of pilot programs that we see on and off. That's one thing that I can think of, and it, not just do it for that crisis time, but because childcare is a crisis. It has been a crisis, like we are talking here today, always, and it's not just one, we cannot just put a bandage and then forget about it.
I agree. Miss Annie, did you want to discuss this?
Yes, I think in terms of what we witnessed during COVID is that when the government wants to get things to people, they do. When they want to make a change or make something happen, they can. And so what we're dealing with is people who don't want to invest in that because it does not necessarily appear to be important to them, and they're not getting the pushback that they should have. It's just like stimulus checks went straight to folks. So, we hear grant $100,000 for this, but you have to look at what is the administrative cost and then how much really truly gets to people. And so how do we get things directly into families' hands or families' providers, where it's a direct benefit that doesn't necessarily have to have administrative costs on the front end, so they could get the quality of the money they truly need for sustainable childcare. But I think it needs to go deeper than that. We finance infrastructures. We have healthcare that has infrastructures. So how can childcare and people's right to life, liberty, and the pursuit of happiness is one of the things to kids to grow up to be good and full citizens and full and not reaching their full potential. They need the development that they get from early childhood, healthy child care providers and educational providers. We need that not only. Why can't we do something in conjunction with the schools? So how do we also have schools provide other services? So is childcare one of those? Not taxing everything, but having a place just like schools that childcare is required. That if I don't send my kids to school, I get some consequences. So why don't we look at ways that we can ensure that parents have those same kind of opportunities for early and small kids and kids when they're not available to go to school or have or go to Big Mama's house. That's my last thought.
Thank you for that. Jenny, did you want to add? And by the way, the audience is loving your tangents. So go right ahead.
Sometimes. Okay. I would just say that your city, your municipality, your county, they have money for economic development. And that's where Taco Bell shows up and they're like, give me some money. And we do. Or hotels or whatever. You can repurpose where that money goes. When they run for office, sometimes these elections are decided by one vote in it's and local officials can be held much more accountable in serious ways. So when you show up to those debates, because you show up to those debates, right? Ask about childcare, put it in the vernacular. It's make that responsibility known and much larger. In the meantime, it is insanely complicated, whether it's benefits, transportation, fencing, it's education. And that's why it's really hard. But, I would start with work at home policies. In the last 30 days, the city has lost 2 stellar employees because we're not being flexible enough. So we're going to get on that. But we have paid a price. And, these are highly educated, impressive women that we have, right? So work at home policies are something that cities can do right away.
Oh, thank you so much. And I can only give you about a minute, but did you want to add something to that?
The only thing is, my reflection was during COVID, society told us who were essential. Grocery people, childcare people, everybody who thought that their job was so important. It literally was, you stay at home, except for daycare people, grocery people, the doctors, nurses. It was just all that stuff where we see them as essential. So let's make sure that we are good stewards of that, knowing that people are leaving this business because there is no flexibility, because there is no more profit in that, and because it's really demanding work, and we need to be aware of that.
I'm talking without being unmuted. You speak of stellar. This has been a stellar panelist. I feel extremely honored to be in your presence today, and thank you for sharing. We appreciate those who are watching today. We are in day 4 of the Women's Leadership Summit, and I hope that you can join us again tomorrow and have a joyous rest of the day. Thank you so much.
This is 365 Media.